Hi, this is Dr. Saxena, and this particularly emergence of this COVID pandemic, and we working with the field of integrative medicine, trying to see what best can help out the person and all that who is in a dire state. And we have been talking about some pro-oxidative therapies from the past so many years now. And one of the pro-oxidative therapy which I believe is can help, and it has been kind of work which was being done by some of the pioneers in the field, and we believe this can be I'm talking about ozone therapy. Ozone therapy is being kind of a pro-oxidative therapy, and this particular therapy is being used was being used in Cuba, Russia, as well as Germany, and it is being dubbed as a alternate medicine product thing. And I'm happy as a mainstream doctor also, having taken a things with some of the big names in ozone therapy, having learned some things from a few of them. And I believe this particular alternate therapy has helped my patients for the past 15-20 years in a significant way. We have been using this ozone therapy for different kind of things. Particularly, we were trying to follow with some allergies, right from allergies to cancer we're using. And yes, infectious diseases, viral diseases, it has got its say. I can always tell you, if I want to name one substance, one particular, see, when you talk about antibacterial, antibiotic comes. When you talk about anti-viral, we talk about few this particular stuff. I am talking about one particular thing called ozone, which is an antibacterial, which is antiviricidal, as well as antifungal. I don't think any other kind of treatment will offer all these three kind of such a good thing, because what is being now on the ground, what we are seeing is you are improving with antiviricidal treatment, your viral count, everything is grown. After some time, you are getting into fungal problem, and fungal also something like we have never seen this kind of things like mucormycosis and histoplasma. These are the things which we are facing nowadays, and for that reason I believe we need to fall back to some of the therapies which have been proven, and this is one of the things which is capable of handling the current pandemic, is this ozone therapy. We had gone to the we are trying to work on some of the things. Dr. Robert Rowan has done a phenomenal work when it came to Ebola virus, and that during that particular stuff, we are as a kind of, there's a group in India which is called Ozone Forum of India. We are there are different groups in all across the world, having gone across with all the groups. I believe the thing is, we are trying to put across this particular thing, that ozone is a viable option. See, ozone has, when it comes to how we tries to work it out and all that, there's a lot of myths which have been spoken about ozone, and I am here trying to tell you that, okay, this is something like, I can give you, see, it's a complex. It's effect of ozonization in the blood is extraordinarily complex, and it's not being properly put across. So what I am trying to put across is, ozone reacts with the serum proteins, including enzymes. It includes immunoglobulins, clotting factors, hormones, vitamins, lipoproteins, cholesterols, and carbohydrates, and electrolytes also. So when you compare blood to an orchestra, I believe ozone administration can be likened to the introduction of a novel and powerful musical instrument affecting the interactions of all others. This is something which I personally feel this has to be used in a big way, and there are different modes of kind of administration, all that. Only thing what I want to tell you is because these leukocytes, which are intimately connected to the immune system, could show good resistance to ozone. And what happens to the viruses, because this viruses this leukocytes possess the enzymes which are called which can protect them from oxidative confrontation. These enzymes are usually superoxide dismutase, glutathione and catalase. Whereas this viruses doesn't have this um, enzymes which protect them from this oxidative confrontation. This is a pro-oxidative therapy. We were talking about vitamin C and all that in low dose is an antioxidant. We have been telling everyone to have a good antioxidant potential. Try to see that you take a lot of vitamin C or vitamin E so that you got good antioxidant. This is a from antioxidant level, we are going into the pro-oxidant level so that it selectively kills the bacteria, viruses and fungi without disturbing any of the normal cells. This is a promising area of research. I would like people have already taken this particular thing. I'm referring to the Baki's work, which was there, and this is the way we try to work it out. So coming to the anti-pathogenic properties. See, as I was telling you, and it has helped not only bacteria, it's antibacterial, antivirucidal, antifungal, as well as antiparasitic also. So this is for me. This is one particular thing which can help so many things at one go. Can be used for treatment of homes and buildings in building syndrome, and it can be used in water supply. It can be used in kind of things. Treatment of indoor air and operating theaters and nursing homes. Now with disinfection of large-scale air conditioning systems in hospital, what I propose a kind of this one. You need that particular in the ambient air. If you can just fill up some ozone with this very minuscule quantity, this is going to help reducing the molds, reducing the spores, and along with that reducing all this things and all that. So this already has been tried, and the Bisleri group has done this in their office, and they were successful. And we also disinfect, at least in my center. When we close and go, we do some kind of ozone installation into the rooms and all that, and becomes a effective sterilization. This pan anti-pathogenic action was applied in the treatment of poorly healing wounds and burns. This is all peer-reviewed journals and all that. And what happens here is it's a kind of wounds. You will have multiple bacteria. You can have so many things and all that. I can always tell you this ozone susceptible viruses are adenovirus, filivirus, hepnavirus, coronavirus, picornavirus, retrovirus also, and ozone sensitive fungi are usually this actinomycosis, aspergillosis, and I believe this has got a combination with hyperbaric oxygen, can have a role for this black fungus as well. And this particular thing has been it needs a more work to be done, particularly when I'm talking about black fungus, because there were no cases which were studied before. Now we have a ongoing this one trial going on in Mumbai and other places regarding the efficacy of this ozone in the coronavirus. So My take is this is a simple technique, and try to work it out with a auto homeotherapy or a rectal insufflation or ear insufflation. We try to work with some saline and all that. But for me, the best part is the direct intra auto hemotherapy. It's called auto hemotherapy, is taking blood out and trying to mix with ozone and send it back. This results are very good. We have tried in a lot of hepatitis B patients, we have tried in a lot of HIV cases, and this works like a, I can tell you it's a magic. And I'm sure with the kind of Dr. Rowan's work on this Ebola with this direct IV ozone, I think this has to be replicated in coronavirus also. Trying to sum up things, I believe there are some areas, and this is a COVID-19, MERS, SARS, and ozone. These are the future of research, and I want people should take into this particular stuff, because it's the most easy thing, and most I can say safest, having worked with a lot of ozone therapies. I don't think I can name the numbers of them. Must have done in thousands, and all of them we had checked out before start commencing the therapy. We try to check out with the something like G6PD and some allergies and all that. We try to take. We don't take somebody having thyrotoxicosis, having some blood coagulation problems and all that. So these are the things we having. Ruled out any contraindications. We try to work on this particular thing, and this is one of the areas where I think this acute pan-inflammatory multi-system syndromes, namely COVID, SARS, and MERS, has to be it has to be looked into a from a different perspective, and I think this is what we have to say, and the perspective has to having worked with so many cases and all that, and we being a group of integrative medicine, and been following all these things, we highly recommend, and can always have a lot of peer-reviewed journals and all that, and we can always provide this particular data. And I request, because this particular problem is still people getting into, once you get out of that virus problem, you are getting into fungal problem. I believe there has to be a good solution, and I urge the people who are into medical treatment, irrespective of whether they are in Ayurveda, homeopathy, or allopathy, let's not get into any kind of scuffle, trying to create any differences and all that. We need to work at this hour for the humanity, and we had seen so many of homeopaths, Ayurvedic doctors also practicing ozone therapy, and this is one of the very good thing which we picked up in the integrative medicine, and I'm really thankful to the people like Dr. Challenger, Dr. Robert Rowan, and Dr. Bocky. These are the people who were the pioneers and started this particular stuff, and I believe this particular therapy can be a real game changer. And when a country like Cuba and all that, they have used in the entire population, I think we should always look into how we can amalgamate this therapy along with, because when we started working ozone, we were not concerned about, because it doesn't have any impact on the other therapies. Mind you, we were working on some autoimmune problems, cancer and allergies, and the people are not ready to switch over totally from one system to other. So apart from taking allopathic medicine, apart from taking some homeopathic, they also were given ozone, and the results were quite phenomenal. Thank you.